have Dr. Prem Tripathi with me.
Hi, everyone.
He's a facial plastic surgeon in the Bay Area. And today we are talking about plastic surgery myths, mostly facial plastic surgery myths.
My favorite thing to discuss.
Is it really?
Oh yeah.
Oh, he loves debunking everything.
Absolutely.
Right?
Yes, because everyone's wrong all the time. No, I'm kidding.
But there's a lot of bad information out there.
Yeah, for sure.
Okay, well, let's get into it. All right, myth number 1. Plastic surgery is only for vain people. Is this true or false?
False. Totally. Well, let's be clear. Everybody as a human is somewhat intrinsically bothered by something.
Yeah.
Right? That is just
or vain.
nature or vain, right? We want to always look our best, and it's fine to look your best at every age. But plastic surgery is not for like self-deprecating people that just sit in front of the mirror all day, narcissistic people. That is not what plastic surgery is about. It's really just wanting you to look and feel your best at any age.
Yep.
And 99.9% of my patients are that. And the 0.1% that are not, that are vapid and, self-deprecating, are not people that should be having surgery. So it's really the opposite.
They're not completely full of themselves.
Right. And it's not going to fix their problem, right? If they're just focused solely on the things that bother them and solely on their face, no amount of surgery is going to help. So.
Yeah, that makes sense.
Yeah.
All right, myth number 2. Plastic surgery makes people look fake or unnatural.
This one hurts so bad.
I know.
It hurts so bad.
I know.
It just destroys the field.
Well, yeah, because all we see is not natural.
Oh yeah, and I'll tell you, it's usually not surgery. It's the non-surgical stuff. Fillers, overdoing fillers will make people look unnatural. I think this also gets perpetuated by celebrities, unfortunately, right? Because people think
reality stars.
Oh yeah, they have all this money. Why would they look like this? They could have access to the best doctors in the world. Why do they look like this? It's not the surgery.
Yep.
Surgery is much more natural. You're repositioning parts of the body, parts of your face to how it was before. It's going to look like you, not in the beginning, but it will look like you once everything's
When
healed.
you're swollen, you're saying.
When you're swollen, you will look bananas, but it'll all settle out and look fine. But it's the non-surgical stuff that is easy, that anybody could just pump into your face, that will accumulate and look unnatural.
And I tend to find, and this isn't like a true statistic out there, but I'm sure if you anecdotally just ask people, a lot of these people that look overdone have gone to somebody who probably wasn't the right person to go to.
For sure.
And they just got them to overfill their faces.
Absolutely. Yeah. I think I often have patients that ask for a particular thing, and it might not be the thing that they are looking for, but they're just asking because their friend had it done.
Yep.
So it's our job to guide them into the right direction, not just do what they ask. Because I'm not like a technician.
Yeah. How about this?
Yeah.
All plastic surgeons are the same, because people will ask me for a doctor recommendation for XYZ surgery, whatever, right? I'll give them actually more than one usually. And I'll say, I like this one for this stuff. I like this one for this stuff. But then they're like, aren't they all the same?
That's a good question. Now everything is getting more and more specialized, right? One day there's going to be a surgeon that just operates on like your right pinky, right? Yeah. So there's facial plastic surgeons. We train specifically in the face, and then we do fellowship in the face. That's it. Yeah. I don't do boobs, tummy tucks, any of that stuff.
Yeah.
There are surgeons that just do eyes. They just do upper lids, lower lids, and that's kind of it.
Yep.
So they're not the same because we're not trained the same. We do different fellowships. We do different training. We operate on different patients. Our aesthetic is different. So plastic surgeons are very much not the same.
Yeah.
Board certified plastic surgeons really are trained to operate everywhere on the body. But as things become more specialized, they tend to focus more in general on things like body work.
Yeah. What's your thing?
Rhinoplasty.
Rhinoplasty?
I love rhinoplasty. It's a different surgery every single time. It's right in the middle of your face. It's very impactful. It's a fun surgery to do. It's very gratifying. Yeah. And it's usually people that have been bothered by their nose their entire life. It's rarely somebody that just all of a sudden woke up and hated their nose.
Yeah. Speaking of that, I kind of think it's a myth that plastic surgery is only for cosmetic reasons.
Absolutely, right? Because breathing is a huge issue. And if you get a really pretty nose that doesn't breathe well, you're going to be very unhappy.
Which we see sometimes.
All the time, right?
Yep.
These are really cute little tiny noses that are done by a famous surgeon or famous people, but they don't work. Mm. So surgery is, anatomy is form and function. It's got to function well. We do surgery on the eyelids, not just so that it looks pretty, but so that people don't have peripheral vision issues.
Yep.
A lot of other surgeries are both a mix of cosmetic and reconstructive.
Yep.
And plastic surgery was born out of reconstructive procedures. I mean, that's where all this started. And of course, things are specialized now. Some surgeons just do aesthetic surgery, but there's a lot of form and function.
Yeah. Wait, are all facial plastic surgeons ENTs also?
Yes. So all facial plastic surgeons, for the most part, went through 5 years of ENT surgery, head and neck surgery, which includes facial plastic surgery. We do rhinoplasties, we do facelifts, we do facial reanimation, and we do those big surgeries where we take out people's jaws and help reconstruct that stuff too. But that's a more specialized field. So after you're done with ENT, then you could further go into specialization. And so that's what facial plastic surgery is.
For people who don't know what ENT stands for.
So it's It's a long word. It's otolaryngology, which is ear, nose, and throat, but it's also head and neck surgery. So most surgeries between the collarbone and the top of the head, not including the eyes, not including the brain. So someone that takes out your thyroid gland, fixes hearing issues, your skull base.
Oh, wow. This is so much more than I thought.
Oh, yeah. Skin cancers, facial paralysis. We do facial paralysis surgery to reanimate the face, fake skin cancer reconstructions, taking jaws out, taking noses off, lots of reconstructive procedures. So it's really very comprehensive. It is the best kept secret in medicine, I think. Because it is an amazing field. It's a tiny area, but it's an incredible field.
Yeah. And you're definitely touching on a lot of things. In fact, I would personally rather have somebody who's trained in all this work on my cosmetic treatments for my procedures for my face, because you have a very intimate relationship with the face.
Oh yeah, it's all we do. It's second nature, right? I mean, it's been years. It's all we focus on. So it really does make a difference.
I don't need another rhinoplasty, but if I did.
No, you don't. No, you definitely don't.
All right, this is a tough one because it does happen to people, but is it a guarantee that you will end up with noticeable scars if you get plastic surgery?
Good question. You will end up with a scar, but it should not be noticeable.
Okay.
So at a conversational distance, you should not notice a plastic surgery scar. And the reason is that plastic surgery scars are not closed under tension. Tension is what really creates that really ugly scar, white lines, or like pulled scars. But surgical scars on the face or under the nose, they're never closed under tension. And so we laser scars all the time to make them look a lot prettier. And so people are not going to do surgery if the scars are noticeable. I tell patients that. It wouldn't hang around long.
I've seen some really bad facelift scars. It's actually one of the reasons why I'm like, I need to do everything I can to not get the facelift.
I see that.
I'm like, oh, should I get the neck lift?
But you're not going to notice the ones that look good, right? You won't notice the ones that don't scar at all.
Yeah.
So, and there's lots of things we can do to help with scarring.
Yeah.
So it is a little bit of a myth.
So wait, what's causing the bad facelift scars? This is for my personal, I'm doing recon, you guys.
So nowadays, a lot of the tension is put on, when we do deep plane facelifts, we don't pull on the skin. So we do a lot of the work underneath the muscle. And so there's no pulling or tugging, and there shouldn't be pulling or tugging on any of that stuff. So if you approximate the skin edges and just suture the edges, what we call them kissing, they're just already there, they don't scar poorly. You don't notice good work. You'll notice only the bad.
He's like, oh, my work. Oh, good work. Yeah. Okay. Good to know. True or false? Recovery is really long and intense.
I mean, it is personal, right? So, I mean, for really active people, it can feel like recovery is a long time.
Yeah.
But plastic surgery is a social downtime. So it's not like abdominal surgery where you're like having trouble getting around.
Right.
This is surgery on your face. You'll have swelling and bruising. It's a social downtime.
Yep.
So I tell my patients, if you actually don't care that you're having the surgery and you don't care if people know about it, you won't have any downtime because you can go out to the supermarket the next day and be fine. Yep. But if you're like, I don't want anybody to know that I'm having this done, it can be a couple weeks of bruising and swelling. But a couple weeks, again, to me, that seems like a decent amount of downtime. To some people, they're like, I can get away for a couple weeks. It's no big deal.
I found with my nose job, the first week, I absolutely didn't want to go out.
Yes.
Probably like at a week and a half, I was kind of like, whatever.
Yeah.
Like, it was swollen, but I wasn't like a weirdo. I also lived in Los Angeles where it's not that big a deal.
Yeah, exactly. I've had patients go to work with stitches in on their eyelids. I've had patients that want to shelter away for a month. So it really depends on like what
you can achieve, right?
Yeah, exactly.
Yeah, because some people can't get away that long too.
Yeah, but it's not prolonged.
This is why during lockdown, there was such a, like all the plastic surgeons I knew wouldn't even get me in for Botox.
Yep. Everybody wanted a lip lift because we were wearing masks. Yeah. Everybody had downtime. It's not the reason to do surgery. No. Like I wouldn't say have surgery just because you have downtime, but it does make it a lot easier.
Yeah, to just get away.
Oh yeah.
All right, this is one that I think is changing a lot now, but still kind of a myth out there. And that is plastic surgery is only for women.
Oh, total myth. Everybody wants to look and feel their best.
Right.
But I think maybe men are a bit more discreet with it. Yep. And there's always a concern of looking overdone.
Yep.
And it's a little more in your face with celebrities, specifically women.
Well, I find that a lot of like manly men don't want to look too feminine.
Oh, of course. Yeah.
Right.
And that, absolutely. That's the concern, is that they don't want to look like someone else. They all have a horror story of somebody that looks terrible.
Yeah.
But it very much is something for everyone. Again, if you're bothered by something, which many people are, there is a solution. But surgery is drastic too. I tell people it's still a surgery you don't need. So you have to consider, the goods and bads. But it is definitely not just for women.
Yeah. And this includes things like Botox and in-office treatments, right?
Yeah. And I'm seeing a lot more men now for that kind of stuff.
This is a tricky one to answer.
Yeah.
Plastic surgery lasts forever.
It's tricky. Because we put time points on everything, right? Like how long does a facelift last? How long does a rhinoplasty
Well, I don't even think people think like, does it last? I think they just assume it does.
Yeah, and you'll always age though, right? So I tell patients like a good facelift will get you maybe 7 to 10 years, but even 20 years from now, you'll still look better having had it done than not. So if you did it and you had a twin and they didn't do it, in 20 years, you'll still look better.
Yeah.
But time will just, we can't stop time.
You still age.
You still age. Rhinoplasties may be a little different because although the nose does change a bit with age and things get a little looser, the sutures and the cartilage will not. So that is one that sort of will hold up for a long time and, theoretically forever.
Yeah.
But facelift, eyelids, these things, you will continue to age. We can't stop that from happening, nor do we want to. You may want something more in the future. But does that mean you wait? You could go either way. You could do it now, have more time to enjoy it, or do it later, do it once.
All right. Well, very interesting, very informative.
Thank you.
Where can people find you on social media?
TikTok and Instagram, Dr. Prem Tripathi, or on YouTube at The Face Duo.
Love it. Thank you so much. We'll talk to you guys soon.